State receives casket of Sir Peter. Goroka Hospital under stress. And CLRC launch review on tax.
This is National EMTV News with Helen Seah.
Good evening and thanks for joining us for Saturday's news. Acting Prime Minister Sir Peter this afternoon received the casket of Sir Peter Lus. Sir Peter passed away yesterday in his hometown Maprik in East Sepik Province. The state has now taken over the funeral arrangements.
The casket of late Sir Peter Lus arrived this afternoon in Port Moresby on a Tropic Air chartered flight. Outside, his grieving family and a handful of the Sepik community waited. Because of his contribution to PNG during the foundation years of PNG becoming a sovereign nation, the state, represented by the acting Prime Minister Sir Peter, received the casket.
On behalf of government, which our Prime Minister, Honorable James Marape, and our police and partners and people of Papua, let me accept the body of late Sir Peter Lus.
The acting Prime Minister also announcing that the state will take over funeral arrangements and award a state funeral.
As we go through, we'll decide on what program that we can prepare for this great man. Obviously, he is equal to all the great leaders that have come and gone.
So I'm very grateful that, the government is recognizing his contribution as a legislator, as a member of parliament. I think he was member of parliament the second longest in the Commonwealth. I think only Sir Michael served longer than he did. So we're very happy, I guess on behalf of the people of Maprik and ECP.
Funeral arrangements will be announced during the week.
He's got his families, some families in Australia and his grandchildren in Australia as well. And as soon as we get all the families up here, we will make announcements on funeral, on the funeral service and the programs of his funeral. The body will be taken back to Maprik after that, and it will be laid to rest in Maprik, within the vicinity of the town. We have made arrangements and understanding with the family. That is before his passing on. Before the independence celebration, we had a very good understanding with the family that Sir Peter Lus will be laid to rest in town.
You're talking to
Sir Peter joined politics in the 1960s. He is among some of the great Papua New Guinean leaders who initiated the talk of independence after experiencing cruelty under colonial rule. The Grand Chief Sir Michael Sumare has always acknowledged him as the person who encouraged him to take up politics and eventually becoming PNG's first Prime Minister. Sir Peter's last public appearance was 2 weeks ago on Independence Day in Maprik Town, an event that also celebrated his life and contribution to the country. Sir Peter passed away yesterday morning at his hometown Maprik in East Sepik Province. Shamin Poriameb, National EMTV News.
The Constitutional Law Reform Commission launched its issue paper on the review of the laws on income tax in Papua New Guinea yesterday. The issue paper highlighted that income tax in Papua New Guinea was among the highest in the world, and disposable income after tax wasn't enough to support a lifestyle for those in the low to middle income range of salary. The public is urged to take part in the review process and give their views to the Commission.
Papua New Guineans formerly employed in the public and private sector earning wages have been facing high rate of income tax in the country. A review of the laws on income tax in Papua New Guinea is being undertaken by the Constitutional Law Reform Commission. Yesterday was the launch of the issue paper on the review of laws on income tax.
This review, to an extent, is doing justice to our people, and I should say it is seeking justice for our people. At least through this review and the consultation process, the people are given the opportunity to have a say as to the kind of changes and reforms they want to have on income tax, specifically personal income tax.
In the issue paper, 3 countries using the same progressive tax system as PNG had their income tax rates compared to that of Papua New Guinea's. The Papua New Guineans' income tax rate compared to that of Australia, New Zealand and Fiji, Papua New Guinea's tax rates are among the world's highest. The 3 countries may have a stronger currency, but they have lower tax rates compared to Papua New Guinea. With the increase in inflation every year and the high tax rates, Papua New Guineans in the low to middle income earning bracket face difficulty in affording decent homes and a balanced, healthy lifestyle.
Whilst income tax, like other taxes and forms of revenue, is fundamental to the overall expenditure and operations of our nation, it should not be burdensome on our people, especially the people who work to make all that the government desires to come into reality.
Papua New Guinea is a developing country that relies heavily on income tax to make the bulk of the country's budget. But only 20% of the population are in the formal sector and pay income tax. The majority, 80% of the population, are in the informal sector. The current system does not really capture the informal economy in a wider tax base to contribute to government coffers.
Our research to develop the issues paper, we have conducted our literature review, and we found out that 20% of the citizens are employed in the public sector, 80% in the informal sector, and government provides the goods and services that governments provide from the tax-based money. We all are benefiting. So we just want views from the people as to how we can make everyone contribute to tax, so we all benefit from the services that government provides.
The public is urged to take part in the review process of the laws on income tax, and the Constitutional Law Reform Commission will be travelling to parts of the country to consult with the public. Questionnaires are also on the CLRC Facebook page and can be accessed, filled in, and returned to the Commission. All information will be confidential.
The consultations will run in selected provinces: Western Highlands, Medan, Simbu, Morobe Manus, and Oro Province, from the 4th to the 13th of October 2021, while NCD consultation will be on the 27th of October 2021. The Commission will also be accepting written submissions from the public until the 5th of November 2021.
Fidelis Sukina, National EMTV News.
Secretary for Department of Justice and Attorney General Dr. Eric Kwa says it is time the department focuses on improving and supporting the operations of village courts in the country. According to Dr. Kwa, the village court deals with 500,000 cases every year compared to the district courts, who handle 14,000, and national court handling about 13,000 cases. Dr. Kwa stated that village courts are the most accessible justice system within the country.
Starting next year, the Department of Justice and Attorney General will employ youths who have graduated from grade 12 to be peace officers and clerks in the...
Because we need data, we need information, we need them to tell us that in the village court area, the biggest crime is probably drugs or maybe this particular crime, so we can be able to respond immediately. And we need information. So we need people who are educated.
Dr. Kwa says selected grade 12s will also undergo diploma programs, which will be funded by the department. He says it will be the department's contribution in reducing unemployment in the country.
Our aim is to give hope to our people that when they finish from grade 12, it doesn't mean that that's the end of the journey for them. They can go back into the villages and join our village court system. And as I said, if you get 5 young people in a village court area who are all grade 12s, then we can then be able to find a way for them to do some programs. And then we graduate them out of the village and they can come and work elsewhere. And then we pick up the other grade 12 who's just sitting around the village. and when we pick them up again. So that is a plan that has been approved by the Marape government, and we are really thankful that we can now be able to implement it.
As stated by Dr. Kwa, there will be no more ordinary village people employed in supporting the village court magistrate. He says by January next year, the support staff must stop work.
Markimul Great Court. All village court magistrates straight about line of place. But it's not support staff. We want educated young people who are supporting our older generation of leaders to improve our service within our communities. So in that way, we think that we can then be able to address lawlessness as part of the prevention mechanism for us at the Department of Justice.
Podivai, National EMTV News.
The Goroka General Hospital is fighting the COVID-19 battle at a level never seen before. The hospital has scaled down on operations due to the surge in COVID-19. Beds allocated for COVID-19 patients are full to capacity, and there is a shortage in oxygen supply at the hospital. This story is filed by our reporter Tekla Gunga, based on information and footage from Eastern Highland Governor Peter Lus' visit to the hospital yesterday.
Okay, I'm here with the Provincial Health Authority, CEO and the Provincial Controller.
Yesterday, Governor Numu went live on his Facebook page in the hope to show people in Eastern Highlands that the lack of practicing preventative measures against COVID-19 is resulting in more people being admitted to the Goroka General Hospital.
So what we see is actually a reflection of what is there in the community. And plenty of money that they inside Laos line and it picks up left and you normally supposed to be testing 10 plan in the 2 plus 3 plus positive. I'm all right, but you testing 10 plan and 7 plus positive and problem, and big problem. So I'm this last thing that number come inside Laos or something.
He was met by hospital staff from the Curative Health Directorate who took him around the Accidents and Emergency Department to see firsthand the number of people being admitted due to COVID-19.
So as you can hear from the staff on ground, all the beds now in the AD is full with COVID-19 staff. And that's why we have our staff there are fully equipped with all the deadline PPEs.
Inside the hospital, the emergency department was divided into 2 rooms to accommodate patients testing positive for COVID-19.
Those are COVID patients, critical
Medical staff dressed in full protective gears are working long hours to assist the admitted patients.
So this is especially the critical one.
But there is a bigger problem. The hospital does not have an operating oxygen plant, so oxygen cylinders have to be transported from outside Goroka.
One for COVID patient, but you should more get additional.
1 day.
1 day.
Normally, 1 plus 1 patient this level, but with COVID, you can the month.
How much of costing 1 plus?
Further inside the emergency department, COVID-19 patients are being accommodated.
Accumulated from the 7th to today is 36.
7th of
7th
September.
of September to today,
36.
36.
And the priority of the hospital right now is to ensure there is enough oxygen supplies for the admitted patients. Outside the hospital, local authorities are now enforcing strict measures by limiting the number of people into shopping centers, introduction of curfew in Goroka town, and the mandatory wearing of face masks. Tekla Gunga, National EMTV News.
The University of Goroka has confirmed a 2-week lockdown as the number of cases tends to increase in the institution and the province. During a conference held yesterday, UOG's acting Vice-Chancellor Dr. Tan Waninga presented an updated statistic on COVID-19 reports from the university. Jamie Hara reports.
The University of Goroka has confirmed a 2-week lockdown as the surge in Eastern Highlands province continues to grow. In a conference on Friday, UOG's acting Vice-Chancellor Dr. Tan Waninga confirmed that there are currently 12 active cases from the institution and so far 2 deaths resulting in the lockdown. He also affirmed that the 2 deaths confirmed were an academic staff and a former employee of the institution.
I'd like to report that we have 13 positive cases at the University of Goroka, COVID-19. Only 1 student was hospitalized, but he has recovered and he was then sent back home. So now we have 12 cases. And at the time of this announcement, it's a virus, we don't know how many are affected at this time, but to confirm 13 cases so far. The Council, top management team and the academic senate are very concerned in the rise of COVID-19 cases because 2/3, about over 3,000 students of the University of Goroka live within and among our local communities. We had 2 deaths so far of COVID-19. One is our academic staff. Unfortunately, we lost him. And the other one was our former employee of the university.
The institution took it upon themselves to purchase 6 oxygen cylinders from Ley to attend to staff and students undergoing isolations or have tested positive.
We are treating and isolating affected students and staff on campus. We don't want to keep them, but we are separating them. And after they are identified as potential COVID-19 patients, or when they are showing signs, we are isolating them quickly. And our staff, we are isolating them in one of the lodges. And our students, we have a residential area where all our students are kept. Then our nurses, our clinical staff are monitoring our students on campus. We have purchased all necessary items and equipment that we need, not all, but very necessary items, including 6 oxygen cylinders in Ley.
Dr. Tan also urged that the 2-week lockdown of the university gives ample time for the students to study for their final exams. The Interim Council has also requested the help of the Treasury Department to assist with funding for more tests to be done if the number of cases increase during the lockdown period. Jamie Harrow, National EMTV News.
You're watching National EMTV News. We'll be back with more stories after these messages. Stay with us. Welcome back. Finance Minister Sir John Pondari officially opened Divinewood University's new Faculty of Arts and Social Sciences lecture and office complex recently. The complex was funded by the Department of Higher Education, Research, Science and Technology through its Public Infrastructure Program. The building took 5 years to complete, costing 7.5 million kina.
Divinewood University has come a long way since its inception as a university in 1996. President Father Philip Gibbs says the university has developed rapidly with new programs and becoming a world-class institute of higher learning. The university has also increased in student and staff numbers.
The university contributes to health services, including rural health, but in recent years, seeing the great need for health services, and with little over 500 medical doctors in the country, the university has taken to preparing medical doctors, and we graduated the first cohort earlier this year. We welcome Parliament's recent passage of the Medical Registration Amendment Bill, which has helped to open the way for registration of our graduates to serve people's needs throughout the country. Our DW University Charter calls for the establishment of an Institute of Higher Learning whose objective is the conservation, extension and diffusion of knowledge by means of its schools, faculties and other resources, thereby promoting primarily the development of students as creative, intellectual persons in a religious environment.
Divine Word University DY Enterprise has purchased the department's high-tech cameras, recorders, including television for its journalism students.
I note that DY Enterprise Limited managed to purchase the new air conditioning system for the TV and radio equipment rooms, including the latest cameras and computers for the faculty that we'll see when we tour the new building.
Finance Minister Sir John Pondari congratulated the Divine Word for another milestone achievement through a government partnership with Divine Word. Sir Pondari says public money given to any organization should be used wisely with accountability. He thanked Divine Word for using the money given by the national government through the Department of Higher Education, Research, Science and Technology to build a new complex for the Faculty of Arts and Social Sciences.
But the fact that in your speech you have reminded us all the ethical use of public money that belongs to the people of Papua has to be spent wisely, has to be used accountably. And as your Minister for Transport, I really do appreciate the fact that I come here to witness a great example of ethical use of our people's money, and for the people, and for the future, and for their development needs, and what more than a project here at the Divine Word University. Thank you, President.
The minister also presented 2 million kina to Divine Word President Father Philip Gibbs. Mathalubis National EMTV News, Medeng.
The Interim Council of the University of Goroka held a conference here in Port Moresby to present the Women Report to the Minister for Higher Education, Research, Science and Technology and Sports, Wesley Raminai. The report was an updated progress of the internal investigations going on within the institution.
Following the establishment in mid-May of this year, the Interim Council of the University of Goroka was tasked to undertake investigations into alleged mismanagement and governance against the top UOG management team and deliver an updated progress within 6 months. Upon progressive investigations, the council led by UOG Chancellor Joe Wemin presented their final report on Friday to DHEST Minister Wesley Raminai. Chancellor Wemin has also acknowledged stakeholders and surrounding communities involved in the progress of the Wemin report.
I would like to acknowledge those stakeholders, the parents and students and the staff and the community who have raised certain allegations about how our university was managed. If there was no allegations raised, some of the things that we have found out would not have been possible. Therefore, this gives me an indication to the council and to the university and even as minister and the government that active citizen participation in our universities, in our government agencies are very, very crucial. Citizens need to speak up.
In response to the Women Report, Minister for DHEST and Sports, Wesley Raminai, acknowledged the Interim Council for their progress on the investigations and also thanked them for delivering the report within the 6 months period.
I'd also like to thank the Chancellor and the team for coming up with the investigative report, the Women Report. Thank you. I'm quite impressed
with the way you guys have come up so far within the last 5-6 months. And I'm impressed.
The Women Report was presented formally before the media and invited delegates. Jamie Harrow, National EMTV News.
A modern community health post was opened on Thursday at Kivori Kui in the Karukuhiri district of Central Province. The community health post was funded by Child Fund and will serve the communities in Kivori Kui and the surrounding LLGs.
The people of Kivori Kui and surrounding local level governments in the Karukuhiri district will have improved basic health services thanks to the good people at the NGO Child Fund.
Child Fund Health Program extended from Rigo district to Kairuku district in 2013. There was a high need of health services to be delivered here. So as part of our integrated community health outreach program and our access to primary health care services through outreach clinics, the construction of the Kivori Community Health Post is one of the activities.
The community health post at Kivori Kui was opened on Thursday by the country manager of Child Fund, along with member for Karukuhiri District Peter Aimo and Governor of Central Province Robert Agarobe. The community health post has a modern setup equipped with a functioning labor ward as well.
The facility will house daily outpatients and where the communities, any public health problems may come, including immunizations, antenatal clinics, postnatal and mothers in labor. So the health post has a delivery room and a bathroom and a toilet just attached to the delivery room, a postnatal ward, medical supplies or medical records, a drug storage room, small minor treatment rooms, and the solar system is also installed. We supported again with the septic or the sewage system that is built up so that the water can, the mothers who are in labor, the waste can be flushed down. It will be managed by the Central Province Health Authority through the Kariku district.
The total cost of building the facility was less than $1 million kina.
The building itself in total cost us about 700,000 kina, but with the septic sewage system cost us about 70,000 kina, and the water system cost us about that, plus the other items and costs, other costs, operational costs. So it's almost about 900 to around 900,000.
It was a day of celebration for the community who turned out in numbers to witness the opening of the modern health facility. It was designed to meet international standards and was funded by the Child Fund Office in Australia through funding from DFAT.
We did a selective tendering process that the design of the building was designed by an external architect that we engaged, and the construction was awarded. The funding source has come from the Child Fund, support through our country office in Sydney. We also had other sources of funding where the Maloney sisters.
Olive Owa, Child Fund Health Program Manager, thanked the people of Kivori Kui for their support in delivering this very important project.
Thank the people of Kivori community as part of their participation. Without them, this community health post would never have been built. Although there were challenges, but we managed to work together with them and help solve those problems.
Fidelis Sukina, National EMTV News.
This weather update is proudly brought to you by MoniPlus, with you always.
I'll look at the weather in the southern region. Cloudy with some rain and thunderstorms in Port Moresby, and cloudy with a few showers in Popondetta.
The weather update was proudly brought to you by MoniPlus, with you always.
And that's been the news, sport and weather for today, Saturday, 2nd of October 2021. Until next time, pleasant viewing, be safe and good night.